All right. So I'll go. My disclosure, I don't have any financial disclosures, and I would say my other disclosure, I don't consider myself an SMA expert. I'm appreciative for coming up to this panel, but maybe I represent the everyman. So I'll give you my case here. So I guess, things that we know pre-SPINRAZA, we have these different categories. Mobility, pulmonary function, death, all sort of fall into these different categories depending on how severe the disease is. But now we have this drug, SPINRAZA, and what we've seen or some of the public literature, this is the outcome, I think, in the type 1 SMA patients where they've shown an almost 50% decrease in improvement in event-free survival. So risk of death or permanent ventilation, again, SMA1 kids, but certainly improvement in quality of life. And then there's another factor, motor improvement. So again, this is the SMA2 kids where there's been a tremendous increase in motor involvement or motor ability in these kids. And so the paradigm is changing in terms of how these kids are doing over time. And while I don't have a lot of children that have SMA, I do have a few. And I will say that almost more than that difference that you see there, I think that the families see a bigger difference. When they have a child who can't feed themselves and then they've been on that medication and now they can lift a fork up to feed themselves or they can sit up by themselves, it's a life-changing event, and the buy-in to this medication and the change that they see in their children, I think is wonderful, but it starts to, I think, change the paradigm of what they see as the outcome going forward. And the case I'm going to present, I guess, brings up another question. So there's many discussions of the technical management of spinal deformity, and Mike has showed that technical sort of change that he's made. But I think beyond the technical considerations, are there changes in the needs that we need to make of the goals of the surgery? And specifically in this case, how do we think about graduates? And I don't have the answer. I'll give you what I did, but maybe it's something that is going to change as well. So this is a 12-year-old premenarchal girl, SMA type 2. She was managed outside in prevents because of progression of her curvature. She's had about 8 years of brace treatment, but the parents have noted a significant increase in the size of the curve over the past few years despite the brace. And you can see she's got a pretty large thoracolumbar curve, 46-degree upper thoracic curve, but pulmonary wise, she's pretty good. She has a sick plan, but she doesn't use BiPAP at night. Her FVC is about 44% predicted, but she's fairly young. She's immature, and she's a Sanders 3. And so there was a lot of discussion about what to do. Again, sometimes you get, maybe I would do things differently now, but we sort of went down this road and we ended up putting in growing rods, even though she's 12, because she was pretty small and pretty young. And so she went these implantation of these magnetic rods, T2 to the pelvis. And this was pre-SPINRAZA era that we did this. But about a year after the rods were put in, she started SPINRAZA injections, and we followed her along. So as you could predict, we did these lengthenings every few months for about a year and a half and really didn't get much growth out of this. We may have corrected her enough that the rods just couldn't push it any further. She matured, and so after about a year and a half and only about a centimeter's worth of length, we really didn't gain much and said, I think it's probably time to stop. We're not going to put new rods in, and why don't we stop? And she's doing well, and she's about 14, and she's getting her SPINRAZA injections, and life is pretty good. About a year or so later, she's doing very well. She continues with the injections, and she's really seen a fair amount of improvement. She's able to feed herself. She's able to roll over by herself, and the parents are exceedingly happy. She's doing fine, but the parents were pretty highly functional, motivated parents. Her pulmonary function is stable, and she's doing quite well, but they brought up a lot of concerns. She's doing so well. She's going to continue to do well. And what about the risk of breakage of the rods? They have some families that have had growing rods that they're friends with that have had breakages. There's also this concern of metallosis that the parents bring up that, she's doing so well. What if she gets leukemia on top of SMA? We don't think we can deal with that. And in the past, we've had sort of discussions of this, even though there's some indication that the magnetic rod should be changed, in a kid with a lower ultimate sort of length of their life, a fairly low activity level. I think that a lot of us or some people would say, I think we can go ahead and leave those in and not subject them to another surgery with a low pulmonary function here. But with this patient and with this group and the improvements that they see, I think there's some expectation that things are going to get better as time goes on, and these new concerns have come up rather than let's just continue to keep them comfortable and not change. So we ended up doing a final fusion in this patient basically to get the magnetic rods out. We did, although you said don't fuse them, we did discuss it with the interventional radiologist before in our multidisciplinary conference, and he said if you could leave that area between above your pelvic fusion and where you go down between L3 and 4, and I know that that's where the opening is, I can get in there and continue to do it. And so we did just what you did. We skipped that area. We went way out wide, dissected around there, left that area pretty much untouched, and they can continue to do that. So I present the case. It's not super mind-blowing, but I think as medical management changed and expectations change, we may see some of these questions as well. Certainly pre-SPINRAZA, the age of onset didn't change, but the mobility was varied by the level, the pulmonary involvement was varied, and the death sort of was varied. But the post-SPINRAZA, while we don't see changes in onset, we certainly see changes in mobility, and we certainly see some changes in pulmonary function, most times decreasing, but the patients are doing more, and there may be an increase in survival as well. So do we have to change the tactic with SMA graduates? I'm not sure, but I bring that case up for talk. Certainly the final fusion is a morbid procedure with the risk of, due to the underlying medical and pulmonary complications, but there is a change in mobility and a change in demand of these patients that maybe we'll see worsening complications with leaving these rods in. There certainly seems to be some change in survival. There's certainly concerns of metallosis, whether that's going to happen, something bad's going to happen or not, we don't know. And there's this need to continue to access space with interstitial space. So I bring that up for consideration.
All right, great, thank you. And unfortunately, we're at our break time, but so we'll have to talk more about this hot topic at the break. But thank you, everybody, for a great lead-in. We're back in here in 20 minutes, I think, right? Yeah, 20 minutes.
Anybody who wants to call a case can bring it to me.
So metallosis, though, isn't